Hello, everyone. Welcome to a presentation of the Office Administration Health Services Program S135 that is offered at George Brown College at our waterfront campus. My name is Mary Cole, and I am the program coordinator for this program, and I'm also a professor in the program. I'm going to talk to you today about a variety of topics that include a program overview, program basics, resources, and just overall some general information about the Office Administration Health Services Program. Our agenda today again, program overview, program basics, admission requirements, success in the program, the courses that you will learn in the program, and careers in healthcare after graduation. So this program is actually designed for those who would like to enter a helping profession in the healthcare office environment. And this would be more in an administrative way, although there are some clinical duties that you might be involved in as well, which I know gets some of the students very excited to think that they might be able to participate in some of them. This office administration program teaches you how to effectively help patients and the clients and just the general public when they're coming into the healthcare facility where you work through both interpersonal, your soft skills, and the technical skills that you might already have and those that you will learn within this program. Courses are all taught by highly experienced full-time and part-time faculty. Some of our faculty have worked in the healthcare facilities in various capacities, and others bring a wealth of knowledge and experience from other careers that they've had. A variety of teaching techniques and methods are used. We have lectures, we have in-class activities, discussions, group work, introduction to healthcare software. And with all of the technology that's out there today, there's always something new that we're trying in the classroom in order to teach our curriculum. It can be very interactive. Upon graduation, you will be prepared to work within a variety of healthcare facilities. All right, so the program basics. So once you graduate from this program, you're going to receive an Ontario College Diploma. This program is a full-time program comprised of 4 semesters. So you are not able to take this program on a part-time basis or in the evenings. The duration, again, it's 2 years broken up into 4 semesters. The great thing about this program is that we also offer 2 intakes. So you actually could join us in September and complete your first 2 semesters, which would take you until mid-April. Then you would have the summer off, and then you would come back in early September for the 3rd semester, which would take you into your 4th and final semester, and then graduation. The other intake starts in January, where you would have your first semester, you would learn throughout the summer with no break, and you would have your 2nd semester, and then come fall, you would join the September intake for the 3rd semester, and then all of you again would go into the 4th and final semester and then graduate. Now, when I said there were no breaks, of course there are breaks. We have intersession breaks in all of the semesters at the halfway point of the semester, which falls in week 8. And between semesters, there is always a break. It could be anywhere from 2.5 to possibly 3 weeks, depending on the semester and the time of year. The program intake. We welcome domestic students and international students from all over the world. Admission requirements. Applicants must have an Ontario secondary school diploma. You need to have grade 12 English. If you do not have English, you could take an English assessment course. Regardless, you do have to take an English assessment test to find out which college English you will be taking, as that is one of your courses, which you will see in just a few moments. Knowledge of basic keyboarding is recommended. Most of us nowadays have a computer, have a phone, an iPad, some sort of technology that we work on. So we are familiar with working on keyboards, but this would be having a good knowledge, or at least the basic knowledge of keyboarding, writing letters, just basic typing. So success in the program, again, as I mentioned, technology and familiarity and comfort with it is highly recommended. And I must say here that having a PC computer would be to your advantage. Some of the software that we teach within this program is not compatible on a Mac. I know a lot of you might have Mac computers. I too have a Mac computer. But just so you know, if you are thinking about buying a computer, a laptop, when you come into this program, which of course you will need access to a computer, a PC is recommended. Students in this program will learn Excel, Word, PowerPoint. You'll also learn a program called Access, which is a database software. You're also going to learn good time management and study skills that'll help you succeed within the program and beyond once you graduate. We do offer a student success program for first-year students, and it's designed to increase success within the program and beyond. And all of our faculty are here to help. We have an open door policy, so please feel free to reach out anytime. There's many resources that are offered at George Brown College. Here are some of them: learning groups and drop-ins. We also have something called the S135 Hub, which is on Blackboard, our learning platform. And this is where announcements, all kinds of different materials that are in particular just for our program, S135, are posted. There's student success email series, one-to-one consultations, in-class workshops, learning and time management tools and tip sheets, self-referral form and early alert, and guide to professional success. I'm not going to go into a lot of detail about these now, but these are just some of the resources that are available to you. And once you join us at George Brown College in the S135 program, you'll learn lots more about these. This program is taught at the Daphne Cockwell Center for Health Sciences at the Waterfront campus. If you haven't been down there, it's a beautiful campus. It's fairly new. I think since around 2013 it's been there, and it's right on the water, Lake Ontario. Just beautiful, not only in the summer, but also the winter. Everybody, classes can begin as early as 8 a.m. Yes, you heard me, 8 a.m. And they can finish as late as 6 p.m. So you need to be aware of this if you are thinking of coming to George Brown College in this program. Classes are approximately 18 hours a week in total when you add them all up. And classes can either be 2 hours in length or 3 hours in length. If they are 3 hours, the teachers usually will have some sort of a break at the halfway point. Please expect to spend an equal amount of time reading, completing assignments, studying for your tests or exams. Coursework will include individual assignments, some group work and presentations, and as I said, tests and exams. Now, let's take a look at the courses that are offered in each semester. So in semester 1, we have a course that's called Strategies for Student Success. I did mention this very briefly a few slides back. This course really does set you up for success as a student within the program. It teaches you many skills: how to get along with others, group work, how to time manage, how to deal with stress, all kinds of things that will be helpful to you as you work your way through the program, and then also once you graduate and begin your new careers. The next course is Anatomy and Terminology 1. This course, it is a tough course, but it's one of the core courses in our program, and even though it's tough, our students year after year tell us this is their very, very favorite course overall in the entire program. It's like learning a new language, medical terminology. You learn about all the different systems of the body, all the different types of procedures that are performed. The next course is Tech and Info 1, and this is a computer course. where you're going to be learning the software Word, Excel, PowerPoint, and Access. And you will see as we go through these semesters and these courses that some of them are building on the previous course. So that's Tech and Info 1. Keyboarding 1 is using your keyboarding skills, so learning how to properly type, where to place your fingers on the keyboard, maintaining accuracy, and working on your speed of typing. The next course is College English, which I previously had mentioned. And then there's something called a general elective, and these courses are required in each of the semesters. And general electives usually have nothing to do with actually the program that you're in. So for example, some of the electives that you might be able to take could be film, art history, children's literature, photography, personal finance. So there's a variety of topics that you could take. Semester 2, Foundation Math. That is a requirement of this program. Then you will see again Anatomy and Terminology 2, building on the first Anatomy and Terminology 1 in first semester. And there again is Tech and Info 2, and that's building on the skills that you learned in the first semester. Then we have a course called Office Procedures. And Office Procedures is held twice a week. It's a 4-hour class broken up into two 2-hour classes. And in this class, we focus heavily on communication, soft skills, how to deal with difficult situations. We also talk about a lot of administrative practices that you will be utilizing in the healthcare facility you'll be working in. Again, Keyboarding 2, building on your keyboarding skills, speed, accuracy. And then another really important course, Introduction to Healthcare Law. This is so important that you have a good, solid understanding of the healthcare laws in Canadian healthcare. Once again, you also have a general elective. The third semester, we have a course called Bookkeeping for the Medical Environment. And yes, we do some bookkeeping at the beginning of the semester, but this course also goes into more administrative type topics as well. The clinical environment. I always like to think of this course as kind of a sister course to Office Procedures that you had in the second semester. Clinical environment builds on things that you've already learned, and it also delves into topics such as safety in healthcare, not only for the patients, but for you, the employee. We also spend a lot of time talking about infection control, which of course is even more important than we ever imagined. Healthcare Documentation 1. This course, you learn all about the different types of documentation that is used in healthcare. You'll be actually creating it, and you will be learning how to transcribe doctor's notes. Health Insurance Billing 1. This is our billing system that we use, OHIP in Ontario, and you're going to learn how to use that and utilize something called the Schedule of Benefits. Both Healthcare Documentation 1 and Health Insurance Billing 1 use a software called Accuro, which is a hospital-based software. So it's going to give you an opportunity to practice on it. Tech and Info 3 focuses in on Excel. And finally, Anatomy and Terminology 3. It's the third of this course. And again, it's building on the 2 previous courses that you have taken. And finally, to round out the courses for semester 3, you have another general elective. Semester 4, your final semester in this program. You'll be taking again Healthcare Documentation 2, building on the previous course in semester 3, likewise Health Insurance Billing 2. Tech and Info 4 is dealing with Access, which again is a database software that is used in a variety of ways in healthcare facilities. There's also a course called Career Launch, and this course is great in the 4th semester. You're getting ready, working towards thinking about applying for jobs once you graduate, and Career Launch offers a lot of content on, again, group work, how to get along with others, resume building, communication. Keyboarding Applications is a course that covers a variety of topics that involve using your computer skills, as well as learning a little bit more about administrative skills within healthcare. Field Placement. This is where you actually put everything that you've learned in all of the semesters so far into actually going to a physical healthcare facility and putting everything into practice. Everybody looks forward to this. It's probably the course that everybody's the most excited about. And we'll talk a little bit more about field placement in just a moment. Then to round off the fourth semester, again, you have a general elective. So those are all the courses that you would be taking within this program. And I hope some of them sound interesting to you. Some of them might sound a bit daunting and you're wondering, oh my goodness. But trust me, we have all kinds of materials that we offer you. Some of these courses have textbooks or e-texts. Some of them don't. Some of them are just based on class discussions, putting things into practice, presentations. We have guest speakers that come in. So there's a variety of techniques that we use to teach these topics to all of our students. So the placement, your field placement experience. So again, the purpose of this is to apply and expand upon classroom learning, everything that you have been learning and maybe even things that you knew before you came into this program. You're going to gain professional experience and you're going to have a chance to really, really work on your soft skills and your interpersonal skills. To qualify for placement, every student must complete and be cleared by something called ParaMed. These are the medical requirements of this program. And also you need to have a clear police check in the vulnerable sector. And these are all things that we would start talking about with you in second semester. Placement takes place towards the end of January in your fourth semester, and it goes to early May. It starts off that you go 1 day a week to your placement, and it's either on a Tuesday or a Thursday. At the end of the semester, which is usually around mid-April that fourth semester ends, you then go for an additional 2-week full time at your placement. So that leads you to the beginning of May that you will actually be completely done this program. The length of this placement runs an average of 140 to 160 hours as the requirement. Again, you will be immersed in healthcare related activities. You could be working on some administrative, technical, or hard skills. And again, patient-client communication and interactions, soft skills. They are huge focus and sometimes the main focus of when you go to your placement. Placement sites are found for students and they may include hospitals, long-term care facilities, walk-in clinics, solo practitioners, and family practices. Placement sites are primarily found within the Greater Toronto Area, but they may be in other areas with approval by the placement coordinator. We've seen some students go to placements in Barrie, in Oshawa, in Ajax, so there are possibilities outside the Toronto area. These are just some examples of some of the places where our students have gone to placement and continue to go to placement. St. Michael's, Mount Sinai, Mackenzie Health, North York General, Holland Bloorview Kids Rehabilitation Hospital, Toronto General, and Toronto Western. As a graduate, you can become a vital part of a healthcare team in a variety of positions, such as a clerical assistant, an office administrator, a hospital unit clerk, an office manager. George Brown graduates of this program are generally perceived by our placement partners and future employers as being well prepared to work in the field. The difference with our program is that we start you off right in the first semester learning about medical terminology. We don't wait until the second year. You are immediately immersed in the healthcare field, learning all the different terms, learning about the different laws, everything that you can think about that you would need to know working in healthcare. So again, my name is Mary Cole. There is my email address. If you do have any questions, please feel free to reach out to me. I really hope that you enjoyed this short presentation on Office Administration Health Services, S135 at George Brown College, and I hope that you join us. Thank you so much, and good luck.